Hello, and welcome to the New Jersey Mature Drivers Tips for Lifelong Mobility presentation. This presentation was developed by staff at the Alan M. Voorhees Transportation Center at the Rutgers University Edward J. Blaustein School of Planning and Public Policy. This effort is part of the New Jersey Mature Drivers Resource Center that functions as a central location for information and links to resources related to New Jersey's mature drivers. Funding for the Resource Center comes from the New Jersey Division of Highway Traffic Safety with funds from the Federal Highway Administration. This presentation provides information and resources to mature drivers as well as individuals who will be interacting with mature drivers. The goal of this training is to give mature drivers the resources they need to make transportation decisions and to have access to safe mobility for their whole life. We will discuss four main topics: changes with aging, driving safer longer, limiting or stopping driving, or driving retirement, and transportation services. In this presentation, we refer to information and links to resources available on the New Jersey Mature Drivers Resource Center website, maturedriversnj.org. To begin, we want to answer the question of why is a training for mature drivers needed? To answer this question, we will look at some of the data related to mature drivers in New Jersey. Firstly, the number of New Jersey residents over the age of 65 has been growing each year since 2011. Mature drivers, those over 65, now make up 21% of licensed drivers in New Jersey. According to 2025 New Jersey Department of Transportation crash data, the proportion of crashes involving mature drivers in New Jersey averaged 26% throughout 2019 to 2025. Older drivers are often safer drivers. However, when they are involved in a traffic crash, older drivers are more likely to be severely injured or killed in that crash. Older drivers also represent a large proportion of roadway deaths, having accounted for almost 18% of all driver fatalities in the state between 2019 and 2024. As the number of overall crashes involving mature drivers increases over the years, mature drivers have a substantial impact on the safety of vulnerable road users, including pedestrians and bicyclists. Between 2019 and 2025, about 15% of pedestrian crashes and 15% of bicycle crashes involve mature drivers. Finally, from 2019 to 2025, the most common factor for crashes involving mature drivers was distracted driving, with distraction as a factor in over 40% of all crashes involving mature drivers during that time period. Now, all these statistics are not happy numbers, but I mention them to show that there is work to do to make our roads safer, particularly for mature drivers. The following four sections of this presentation will highlight different strategies to address these safety concerns and help mature drivers experience safe mobility for life. Let's start by discussing the changes that occur with aging that can affect driving, and how to help people drive safer longer through driving assessment, driving instruction, and driving technology. We can't say that someone should stop driving because they reach a particular age, 70, 80, even 90. People age at different rates. The ability to drive safely is based on both physical ability and mental acuity. When looking at driving and aging, it is important to consider the specific changes that could impact an older adult's ability to drive safely. The normal aging process involves physical and cognitive changes that may affect driving skills, and for some individuals, disease or medication that can compromise driving ability. Changes in vision, hearing, cognitive skills, and physical condition, such as flexibility and response times, can require adaptations to maintain safe driving, or require driving retirement. However, being aware of these changes, assessing their impact, and participating in driver training may help older adults continue to drive safely. When we think about changes in driving ability, we may think of vision first. Most older people will experience changes in night vision and light sensitivity, but other conditions, such as the ones listed here, can also have an impact on driving. Vision tests can help determine any deficiencies. Drivers take cues from what they hear around them. Older drivers may have difficulty tracking sounds in their environment, such as sirens or other high-pitched noise. They may be more distracted by conversation in the car. Driving is a cognitively complex activity. Cognitive deficits, such as memory issues, sleep disorders, stroke, vertigo, and Parkinson's disease, can seriously compromise driving abilities, including response time and wayfinding, and can increase distracted driving. Arthritis can stop an individual from moving and bending shoulders, hips, hands, head, and neck. This can limit their ability to turn their neck when parking, get into and out of the car, press the brake and accelerator, especially in heavy traffic or driving during rush hours, and other common driving activities. Over-the-counter and prescription medications may affect the older driver's ability to remain alert and focused. Some medications may cause drowsiness. If a mature driver is unsure how a medication may affect their driving, they should contact their primary care provider or pharmacist. Check out the Resource Center website for links to resources on medication and driving. Dementia and Alzheimer's present unique challenges to mature drivers' ability to drive safely. Making the right choices about driving with these diseases takes time and many different considerations. There are several sources of guidance that are available for information on driving with dementia and Alzheimer's. The Hartford At the Crossroads Guide is one resource, and information is also available from the National Institute on Aging and the Alzheimer's Association. Check out the Resource Center website for links to these resources. Older drivers may make adjustments for these physical and mental changes as they become more cautious and less comfortable behind the wheel. They may stop making left turns. They may drive shorter distances and take more breaks on a longer trip. They may choose to avoid traffic congestion, such as during rush hour and high-speed roadways. They may choose not to drive in bad weather or at dusk or nighttime. Or they may choose to use a newer car with assistive technology if they are familiar with how to use it. Other resources on changes with aging and mature drivers can be found through these two websites, the Merck Manual and the Clearinghouse for Older Road User Safety, or CORUS. They have a range of information on various related topics. The Merck Manual for the Older Driver is part of a series of free manuals provided with the goal of making accurate medical information accessible and usable. Two versions are available, one for medical professionals and one for consumers. The Clearinghouse for Older Road User Safety serves as a one-stop shop for materials and resources related to lifelong safe, independent mobility. Materials and information are available for varied audiences, including older drivers and family members and caregivers of older drivers. Check out the Resource Center website for links to these resources. Now that we have addressed the possible changes that come with aging, we will transition to talking about assessing how these changes may affect a person's driving. As we noted, people age at different rates. When looking at driving and aging, it is important to consider the specific changes that could impact a particular individual's ability to drive safely. We can address some of these changes through driving assessment, driving instruction, driving technology, car fit events, and vehicle adaptation. Driving assessments are tools used to measure a driver's abilities and safety while on the road. Assessments can be made through the use of an online assessment tool or through an in-person assessment. There are several online self-assessments available through the National Highway Traffic Safety Administration, Health and Aging, AAA, and AARP. An assessment can also be made by a certified driving rehabilitation specialist, which we will discuss later. And some occupational therapists have training in driving assessments. Check out the Resource Center website for links to these resources. A driving refresher course can be helpful, and both online and in-person courses are available. Many courses are geared specifically towards older drivers. AARP offers courses, and the New Jersey Motor Vehicle Commission provides a list of companies with training tailored to mature drivers. There are costs associated with these courses. Links to these resources are located on the Resource Center website. CarFit is a community-based educational program developed by AAA, AARP, and AOTA, the American Occupational Therapy Association, to promote continued safe driving and mobility among older drivers by focusing attention on safety, comfort, and fit. At CarFit events, trained volunteers review a 12-point checklist with driving participants to assess how well the driver fits in their vehicle and to explain vehicle safety features. In these 20-minute sessions, technicians often recommend minor alterations of the car seat, steering wheel, and mirrors for a better and safer fit. CarFit classes are offered through AAA and other organizations throughout New Jersey at no cost. Some events are listed on the CarFit webpage, but not all events. You can contact AAA to request a CarFit class in your community. CarFit resources are available on the Resource Center website. If drivers are operating a newer car with any of the technology listed here, they should be familiar with how these tools work to help them drive safely. You can find informational brochures and short videos on vehicle technology at AAA's website. Drivers with special medical considerations and disabilities may benefit from a consultation with a Certified Driver Rehabilitation Specialist, or CDRS. These specialists provide numerous services such as evaluation of a driver's capabilities in physical and cognitive terms, vehicle outfitting with adaptive equipment and training in the use of the equipment, and rehabilitation services for individuals with an illness or injury that has impaired their driving. Costs vary depending on the provider, type of driver rehabilitation program, and length of time required to complete the evaluation. Some providers accept medical insurance, while others charge a fee for services. It is important for individuals to ask about costs, billing, and financial support when they are contacting their local driver rehabilitation specialist. The New Jersey Motor Vehicle Commission maintains a list of rehab centers that provide this service to Jersey residents. Search New Jersey Motor Vehicle Commission Driver Rehab for access to the website. You can also search for rehabilitation specialists on the Association for Driver Rehabilitation Specialists, ADED, website. Links to these websites are available on the Resource Center website. Vehicles can be adapted to address some changes in physical abilities, such as reduced flexibility. The list shown here mentions some of the possible adaptations that can be made. The costs for these adaptations range widely, but some are very low cost. Some of these adaptations are discussed at CarFit events. Certified Driver Rehabilitation Specialists can assist in determining if these adaptations might be appropriate for a particular driver. Having discussed how to drive safer longer, it is also important to discuss the possibility of one day putting down the keys. We can use the term driving retirement for the process of limiting and stopping driving. It may be that the older driver can continue driving, but may need to make some of the adjustments we mentioned earlier, such as driving during less busy times and only during the day, driving only to locations they are familiar with, only on local roads, or driving with someone. If the decision has been made to limit driving or stop driving completely, the mature driver will be looking for a plan to maintain independence and self-sufficiency. The conversation about stopping driving can be difficult, but preparing for the conversation can help. How do we know when it is time for someone to reassess driving? These warning signs and symptoms may give a family member or caregiver an indication that an older driver should consider limiting or stopping driving. Do they seem uncomfortable, fearful, or nervous while driving? Do they have difficulty staying in their travel lane? Have they become lost on familiar roads or in a familiar place? Do they fail to pay attention to road signs, signals, or pavement markings? Do they slow down when faced with an unexpected situation? Have they experienced near misses? Do they have trouble gauging gaps in traffic at intersections or exit ramps, or emerging situations, or changing lanes? Are they easily distracted while driving? Have they received tickets or warnings recently? Have they misjudged a situation? Are there new dents or scrapes on the car, garage, fences, or mailbox? If the decision has been made to start the discussion about driving retirement, take time to think about the following: the meaning of driving from the older driver's perspective, how to begin the driving discussion, strategies for driving reduction or retirement, how to talk about navigating the community as a non-driver, local transportation options, starting the conversation before a crash or other crisis occurs, and how to continue the conversation over time. It is important to start this conversation before a crash or other crisis forces the conversation. This approach allows time to develop a plan for mobility after driving cessation. Families are relieved by knowing that there is a plan. The older driver may be relieved that there are options and they are not forced to continue driving. The conversation can be continued over time, giving the individual the opportunity to become used to the idea and to explore transportation options. Why do mature drivers continue driving even when there are warning signs present? It may be because they don't know how they will get food, medication, or how they can keep doing everything they do now, like visiting friends or getting to the library or exercise class. They don't want to be dependent on others for getting around. They could not make spontaneous trips. Every trip must be planned, unless they are walking or bicycling. They will be isolated and feel lonely. They don't know how to get around without a car. Any conversation with a mature driver has to take into account these and other fears. Isolation can negatively affect health, so we want to make sure that individuals have alternatives to driving. The conversation about when to stop driving can be difficult for everyone involved, but it is important to keep talking. As a family member or caregiver, you might be concerned about the older driver's response, appearing disrespectful, the fact that you or family members may not live nearby to help meet your loved one's transportation needs, isolating the older driver if they live alone, the older driver not wanting to ask for rides, leading to less social activity. To address these different fears that may arise, it is good to plan ahead for the conversation. AARP's We Need to Talk online seminar and Florida's Guide to Safe Mobility for Life can both help with thinking through this conversation. Both of these resources are available on the Resource Center website. AARP's We Need to Talk material suggests early, occasional, and candid conversations. The conversation's focus can be on the driver's safety and level of comfort. Some example conversation starters include: I am concerned about your safety when you are driving. Driving isn't what it used to be. Have you asked your doctor about the effects of your new medication on driving? I'm worried about you getting lost. I'm glad you stopped driving at night. I don't want you driving if you're uncomfortable or feel it's too risky. One of the key parts of driving retirement is knowing about other options to get around. Let's take a look at some of the alternatives to driving and their benefits to the older driver. As we have been discussing, safety is the first reason to stop driving. Safety of the mature driver and safety of others using the road. There are other reasons for driving retirement as well. Owning a car is expensive. Walking and bicycling are healthier alternatives if available. And lifestyle benefits such as meeting new people and getting to know the neighborhood. We don't often think of the total cost of owning and driving a car. The car cost calculator shows the real cost of driving a car, including insurance, repairs and maintenance, and fuel that can add up to a significant portion of an older driver's budget. The money saved by not owning a car can be put toward paying for the bus, taxi, or Uber and Lyft rides. A link to this chart is available on the Resource Center website. It's not just a matter of how driving retirees will feel. They also need practical answers to questions such as, how do I get food? How do I get to medical appointments? How do I get to the park to walk, to the gym? How do I do other errands? How do I get to worship services? How do I visit friends? And of course, these are just a few of the activities they will want to continue. What are the options for alternative transportation? Asking family and friends for rides? How walkable is their community? If the individual has the ability to walk the distance to what is needed, this is an option. NJ Transit buses are in many communities and frequently have routes to nearby shopping centers and malls. Specialized transportation is available in all counties. Paratransit, available by appointment ahead of time, can make routine essential travel, such as to the doctor's office, easier. Other community transportation, such as vans, taxis, Uber and Lyft, provide transportation in New Jersey communities. Take a moment now to consider, what are the options in your community? Some possibilities include a senior bus, walking or bicycling, volunteer driving services, ride-hailing apps, paratransit, and NJ Transit. If the mature driver lives in another community, you can contact the Office of Aging in that town or check the municipal website to learn about available transportation options. Let's finish our discussion on driving retirement by reviewing practical tools available to plan transportation routes and continue getting to where we want to go. The key to successful driving retirement is planning. You want to talk about not only needed excursions, but desired trips. Then build on that list to find ways to meet these needs. The table below lists some of the destinations that people will want to access. You can create a transportation plan that will answer the questions, where do I want to go? How often do I go? How far away is it? What transportation options are available? Can I combine trips or use two modes to get there? The idea is to reassure the individual that when they give up the keys, they will not be housebound, that there are alternatives to driving and their needs can be met. Check out the Resource Center website for links to these resources. For example, let's say I want to go to the senior center once a week on Tuesday mornings. It's a mile away. I could get a ride from my friend who is still driving, or I could take the municipal van, or I could get a Lyft ride. I will put riding with my friend as my first choice. I know the municipal van will be there to bring me home, so I will mark that as my alternative option. You want to make sure that all destinations are listed and all transportation options are listed. Only include options that are comfortable for the individual or that they will really use. Ensure that the option is practical. If the bus schedule does not work for the individual, it is not really an option. Once the plan is complete, test it out to see if it works for the individual. Several resources are available to provide guidance through the process of driving retirement, such as the ones listed below. All of these resources are available on the Resource Center website. As we finish this section, there are some key takeaways to driving retirement. First, change is hard, and it may bring up some fears. This is natural and to be expected. Being aware of these fears can help family and caretakers approach the conversation with empathy. It is also important to think through what driving retirement will mean for the mature driver. What activities do they now need to find transportation for? What local transportation options are available? Are there any unique challenges they will face as they retire their car keys? Finally, it is important to remember that driving retirement can be done well. Doing research into other transportation options and developing a plan with the mature driver early on can ensure a successful transition to living car-free before a crisis arises. Familiarity with the transportation services available to your community will help you in making transportation decisions. NJ Transit offers bus, train, and light rail service throughout the state and connects with other transportation providers at major locations across the system, including Amtrak, the Path to New York City, and SEPTA to Philadelphia. For those 62 years of age and older, half-price fares are available with proof of age. The Metro North line is the only line that requires passengers to be 65 to be eligible for half-price fares. Proof of age is any ID or document issued by a government, social service, or mass transportation agency and printed with the rider's date of birth. What is accessible? All buses are accessible with bus lifts or ramps, and all buses have securement systems for mobility devices. The lift can be used by anyone. You do not have to be using a mobility device. Many rail stations are accessible with elevators, ramps, mini high-level platforms, or portable lifts. Bridge plates are available at all high and mini high-level platforms for boarding trains. Details on accessibility are available on the NJ Transit website. NJ Transit provides paratransit service throughout the state. Under the Americans with Disabilities Act, or ADA, transit agencies must provide paratransit services for people with disabilities who cannot use fixed route transit services. In New Jersey, this NJ Transit service is called Access Link. There is an eligibility process. Access Link will provide transportation service when the origin and destination are within 3/4 mile of a NJ Transit local fixed bus route. It does not serve as a regional transportation, into New York City, for instance. It operates as curb-to-curb service and requires reservations. Older individuals who own cars are used to getting around by driving and may not have used public transit for years, or ever. The New Jersey Travel Independence Program, also known as NJ TIP at Rutgers, teaches individuals with disabilities and older adults how to use public transportation safely and independently. NJ TIP customers learn how to read bus and train schedules, plan their trips, pay their fares, and take safety precautions. The only cost to customers during training is paying their own fares. For more information, call 848-932-4499 or email njtip_info@njtip.rutgers.edu. Benefits of the NJ TIP program include increased access, empowerment and independence, more options, and cost savings. More information on NJ TIP can be found on the Resource Center website. Community transportation providers use small, lift-equipped vans and minibuses and may operate curb-to-curb, door-to-door, or on an advanced reservation basis. Every county provides these services. Services may feed into existing mass transit bus stops, train or light rail stations. Although there are some services open to the general public, others have eligibility requirements and may be restricted to senior citizens, people with disabilities, or social services clients. Go to the Mature Drivers website for links to your county webpage. In addition, many municipalities provide older residents with transport via a van or small bus. Information about these services often can be found through municipalities' Office of Aging. Local nonprofit organizations also may operate transportation services. Taxis and ride-hailing companies are known as mobility on-demand services. Transportation network companies, TNCs, such as Lyft and Uber, pair passengers with drivers via websites and mobile apps. Both Uber and Lyft have senior versions of the apps and provide app features relevant to mature transportation users. If the individual is not comfortable with phone apps, concierge services such as GoGo Grandparent and Easy Ride for Life help older adults link to Lyft and Uber. Users only need limited technology experience for these services. There is an annual membership fee and an administrative fee, and rides are prepaid. Check out the Resource Center website for links to these resources. New Jersey's 8 Regional Transportation Management Associations, or TMAs, are nonprofit public-private partnerships that provide transportation information and services to facilitate the movement of people and goods within their service regions. Many provide targeted services to older adults as drivers, passengers, commuters, transit riders, bicyclists, and pedestrians. TMAs can help residents navigate through a range of mobility options, including services provided by municipalities, counties, local nonprofit providers, private bus carriers, and NJ Transit. Some provide classes about transportation, and some have information by municipality. Web pages listed here are available on the Resource Center website. A walkable community improves overall quality of life by creating an environment where people are encouraged to interact and develop a sense of community. In fact, research indicates that people who live in walkable communities are more likely to be socially engaged and trusting than residents of less walkable neighborhoods, and also report being in better health and happier more often. By keeping fit and maintaining flexibility, older individuals may be extending their ability to drive and are keeping healthy. Complete Streets are designed and operated with the safety, mobility, and accessibility needs of users of all ages and abilities in mind. Investigate these websites for information on pedestrian safety for mature adults. As we have discussed, arthritis, vision and hearing limitations, and agility, among other issues, can affect safety. In the past few years, we have seen an increase in delivery options from a wide range of retail stores. We can have groceries, clothing, pet food, hardware, meals, medications, and books delivered. This option may reduce the need for some trips out. Accessing these services does take some ability with online systems or phone apps. Ask businesses in your area if they offer delivery. Meals on Wheels are delivered by volunteers who also provide some social connection. Information can be found through every county's Department of Aging. With these delivery options, the need for rides can focus on getting to the doctor, visiting friends and family, and going to exercise class. Online offerings of cultural, social, and recreational activities have increased, including online book groups, museum talks and tours, readings, meetings, courses, and theater programs. Access to these offerings requires some training in the use of technology. They may be an option, for example, when the weather is bad. In addition, many public libraries provide free online resources. Overdrive, Libby, Canopy, among others, provide access to ebooks, audiobooks, and videos. The 211 New Jersey Transportation page has several categories to choose from. They provide live assistance 24 hours a day, every day of the year, including information on transportation options. Their services are free, confidential, and multilingual. Check out the Resource Center website for links to other resources. The Mature Drivers Resource Center website, listed below, provides information and links to resources to address all the topics we covered today. Physical changes that affect driving, driving safer longer through assessment, training, and instruction, transportation options, and resources for family and caregivers to help in limiting driving and the transition to car-free living. Thank you for your time and attention today. If you have any questions, please visit our website or email us at maturedriversnj@ejb.rutgers.edu. Together, We can help mature drivers experience lifelong mobility.